Hi, I'm Dr. Nidhi Bhatnagar Harjai, and today we'll be talking about writing disorders in aphasia and how you can practice for good handwriting once you have met a speech language pathologist and you need to practice those exercises at home. So when we begin with therapy with a patient with Broca's aphasia or recovering aphasia and we are starting with the writing practice, normally the things that we generally pick to start our writing exercise with is the patient's own name, address, mobile number, spouse's name, kid's name, office name, or any other thing which is vital or of relevance to the patient. On day one, when you make the patient do an attempt of writing, you will be able to make out whether the first attempt was really good, bad, or extremely insignificant. So if you fall in the latter category where the attempt was actually quite miserable, you have to understand that why we were trying these things was to get a baseline, to judge the level of performance of what the patient can do and eventually what we want him to start doing. So if you started with the name of the patient and he was unable to write that, if you started with numbers and he was unable to write or trace the numbers, maybe you started with a certain figure and the patient was not able to make it, then it means you need to get back to the basic of writing. That will be something which we call simple joining of two dots. So say for example, this is a sheet of paper. You're going to make two dots which are not going to be very far away from each other, and ask the patient with a marker, a thick marker or a sketch pen. Remember, it should not be a thin pencil or a pen which we use for normal handwriting. It has to be something thick which will be easier for the patient to grip, maybe not in the perfect manner, maybe with a little bad grip, but nonetheless he will be able to hold it and start trying. So once you have made these dots, you simply ask the patient to try and join them and say he joins it. Now obviously when the patient will try and join them, you will see some amount of mistakes. These are called overshooting and undershooting. So by overshooting, we mean that he was supposed to join from this place to this place, but his actual attempt went way ahead. And undershooting would mean that he was required to join from here to here, but somewhere he left it in between. So these are very common errors that you have to keep noting on a day-to-day basis, that what is the kind of pattern which is emerging. To start with, make sure that your dots are placed very nearly. So for this, what you can do is probably you can take the help of a ruler or a scale and make sure that all your dots are approximately of the same length. And on a single day, when you're asking him to start the exercise right on day one, make sure that these are not more than 5 to 7. It's more than enough. 5 to 7 attempts of dot joining is good enough. So these were the horizontal lines that we were trying, and also you can try for the vertical lines or the standing lines. So two dots like this, and you can ask the patient to join them and see for any undershooting or overshooting and just make a record. So simply, instead of writing the name, the mobile number, the address, we can just start with plain joining of dots and not too many. Remember that. Now again, another thing which I would like to recommend, I normally in my personal experience have seen that certain patients, what they do is they start maintaining a diary or a register. So what happens is that if on day one the attempt at writing, say, was miserable, was quite bad, on day two it was again the same, over a period of a few weeks the writing becomes better. So every time when that journal or diary is opened up in front of the patient goes through all the pages to see how he has been improving or he has not been improving. For us to say at this particular stage whether improvement will be rapid or slow is very difficult. So just in case if the improvement is rapid, it's a big thumbs up. But say for example, if the improvement is slow, it will become very demotivating for the patient to again and again every day go through those miserable sheets to see that he is not improving at all. So the best thing to do is to take plain A4 size papers and markers like these. Just put the date on top and ask the patient to attempt his joining of dots. Once he's finished this activity, make sure you file the paper. You are not supposed to throw the paper. File the paper date wise, and over a period of time you will start having your own journal where the therapist or you yourself will be able to analyze how he is improving in his handwriting skills. So as of now, there will be no words, no address, no telephone number, nothing like that which has to be tried. We'll stick to simple joining of dots in the horizontal plane and the vertical plane and just go about it for 2-3 days. Now we need to understand that handwriting is a fine motor skill, just like speeches. So if there is a fine motor skill, fine motor activity which has been affected because of aphasia, you have to make the patient develop a better grip and a better mobility for his fine motor skills. So for the fine motor skills, few things which you can use at home could be something like this Jenga toy. So what you can do is you can take a few of these Jenga rectangle cubes and probably just ask the patient to stack them one on top of other, something like this. So the initial attempts might be crooked, but then I personally feel that these Jenga cubes, they are a little big and bulky and easier for the patient to kind of hold, maybe if not like this, maybe with a crooked grip, but generally the patients do well. Sometimes some people even try this with blocks, but I personally feel that these are even better than blocks, because in blocks you're required to put them right on mark to mark and join them. So that becomes a little complex activity in certain cases. At initial level, these are a very good thing that you can start with. Say for example, if you do not have them, you can probably use small saucers and small bowls at home that the patient can try and stack one on top of the other, just for getting a fine motor skill improvement. So if you're using something like these carom things, then again when you're asking the patient to maybe collect them and put them inside a box, you need to instruct him to use his finger and his thumb. We cannot be picking up the coins, the carom coins, like this. They have to be picked up with one finger and thumb like this and then kept inside the box. So if this is our box, so if this is the box here, it has to be picked up like this and put inside, picked up like this and put inside. This should be discouraged because we are doing this activity, we are targeting writing. So what we want to actually develop is the pincer grasp. So these are a few tips that you can keep in mind while practicing writing at home. So all the best with writing skills with a patient with aphasia. For any clarifications and details, you can please get back to me. Thank you.